Hey everybody, welcome back to Health Matters. I'm Ryan O'Connor and this is in association with Cipla. Now, ensuring patients take their medication as prescribed is vital for managing chronic illnesses and of course in improving health outcomes. Now, to discuss the importance of adherence, the challenges that people face, and of course how we can overcome these obstacles is Dr. Craig Nossel, co-founder, Chief Medical Officer of Evia Health. Now, Evia Health use technology and that technology helps us in conjunction with behavioral economics and data to empower patients to control and improve their health. Let's begin on why medication adherence is so crucial. Craig, welcome to the podcast.
Thanks very much, Ryan. I appreciate you having me, and really a critical topic I think that we need to cover, and really the question of why do we need to take our medication. Well, I guess the doctors wouldn't have studied all these years and prescribed medication if we didn't need to take it. And so medicine helps us keep well, keeps us out of hospital, prevents complications, ultimately keeps us alive. And so we're seeing people living longer. But the problem is if we don't take our medication, we see healthcare costs increasing significantly. A study in the US shows about 10% of hospital costs of people just not taking the medicine that they should be taking. And, even across Europe, I heard a stat, something like 200,000 people die across Europe not following the medication prescription. This is almost on a regular basis or daily basis. And so, medicine is probably the simplest way and the most cost-effective way to keep us healthy. And to keep us out of hospital and to keep us, living not just a longer life, but a better life. And I think that's really the crux of this.
Craig, I look back and I'm on chronic medication myself for epilepsy, and it's I remember when I started on it, the journey to try and being consistent with the times of the day in which I was taking the medication. Initially, and when I started, I was obviously much younger. There wasn't technology available to remind me to take your medication, and when you were taking it twice a day, if you missed it for an hour or two, the body clock, and especially around that type of medication, the biggest alarm clock was the feeling I'd get. I would feel that I hadn't taken my medication. But obviously, there are many other challenges that we face with people being adherent to medication and not following, obviously, as you mentioned, the prescribed dosage at the right time.
So I think, I'm going to say as a medical professionals, quite naive, despite being, smart people in the medical fraternity, quite naive around how patients will behave. And we'll come a little bit later, as you said, to the behavioral economic side of it. But I think that the reality is that as humans, we forget, regardless of how smart one is or isn't, we forget. But it's often more complicated that there's often a cost to medication. And cost may be a financial one, it may be time. So going to the pharmacy, collecting one's medication, those are barriers. Then our knowledge is a big issue, so doctors and our GPs today and specialists are incredibly busy, and often not because the intention isn't a good one, but don't have the time to explain to patients why they need certain medication, how the medication may work, and importantly, side effects. And that's a big issue. So, you obviously, and I appreciate you sharing your journey around medication, had certain symptoms and the downside or the effect of not taking this is much greater than the effect of taking it. For many people, the side effects of medicine is actually much worse than the actual effect because they're not feeling ill. And so we see a lot of patients, and again, I've seen studies where, someone gets a prescription, within 6 months, only 30% of those people are still taking that medicine because they feel fine and think, oh, okay, the medicine makes me feel worse than my condition made me feel. And probably the most common chronic condition is high blood pressure or hypertension, and we feel fine. It's called the silent killer for that exact reason. You don't feel unwell. And so all these sort of things, and there's also cultural issues. There's often stigma attached to medication. I'll maybe probably talking more for myself, but maybe I represent other males of similar age to me. You kind of feel, oh, I'm getting old now that I need to take these medicines for certain chronic conditions. And do I want to be doing that? And so the healthcare system and how people are prescribed, a lot of these things we don't understand, or we don't engage with patients or customers around that. And that creates this low utilization or poor adherence. And we see in South Africa, the average is about 54 to 60% of people that are taking their chronic medicine. Globally, that's sort of a similar number. And we're in a situation, certainly if I look at the private healthcare industry, cost isn't the issue, because these are prescribed minimum benefits. So they're benefits that all the medical aids have to fund. So it's not that people are out of pocket that, because of the economic conditions, I'm not able to take it. So it really is a lot of these other issues that are barriers to people. And I just think, and obviously the work we're doing in Evia, it's critical to shift that. This is where the healthcare savings will take place, and will have a positive impact on people's health by just getting them to take this pill. And as you said, sometimes it's complicated. Do I take it in the morning? Do I take it before breakfast, after breakfast? And I guess we'll come to it, but that's where, this innovative technology has really, I believe in what we're seeing, a game changer in how we deal with people with needing chronic medication.
Absolutely. I guess you've almost touched on one of the solutions there when you talk about technology, because certainly that was how I reminded myself to be punctual and on time ahead of taking said medication. But those obstacles, how do we overcome them? And why is it obviously so important in healthcare delivery?
So I think, like anything, there's the innovation that's taken place in, I guess, many areas, and healthcare is one of them, where, the side effect profile, we talk about this precision medicine, where, cancer treatments, these biologicals that focus on the exact point of where the treatment needs to happen. Amazing technology and advancements and innovation happening in that place. What's interesting is that the innovation in how we get our medicine. So we're still standing in queues in pharmacies very much. We see that the medicine's still coming, whether it's a box or a plastic container. Those things haven't changed, despite the fact that the actual medicine is so much better than what it was, and also a lot cheaper than what it was many years ago, if we look at sort of the main chronic conditions. So when I talk about technology, I think there's various aspects. So the one is obviously applications, and there's been a lot of work done around providing various apps to give people reminders. The problem that I've seen, and when we're dealing with chronic medication, and people with multiple chronic conditions, so what we call comorbidity. So they've got high blood pressure, high cholesterol, they may have arthritis, they may have other heart conditions, diabetes. There are people that are taking 6, 7, 8, sometimes, over 10 medicines. And to remember to take that, but also that's generally, and a slight generalization, but certainly the data that we have supports that, an older population group. And so having another app is probably not the ideal solution.
Got you.
And so we need to almost understand what we talk about patient-centric solutions. And it's all very well that you've got a younger person and they can set the reminder on their phone or have an app and very, engaged with technology. When you've got an older person who hasn't grown up with these technologies, we need to sort of understand that behavior a lot better and develop technologies, and even things as simple as the font that things are printed on. And I guess I'm showing my age here, but I go to a restaurant and I have to lift up my glasses so I can read the menu. And so these are the sort of things. So when one looks at technology, sometimes the innovations are actually simple. It's not always the complicated things. And getting back to basics and then innovating around that. And I think that's what's to some extent has been missing. But, just when we talk about technology, the fact that a script, you go to your doctor and the script can go straight through to a pharmacy already, that lowers the barrier, because it's not, I've got this piece of paper, I'll go do it tomorrow, I'll remember, I forget, and I don't do it. And appreciate I'm coming, I've studied medicine as a medical professional, as a doctor. If it wasn't for my wife, I'd also forget my chronic medication. And so it's not about knowledge, it's about behavior. And how do we use technology to make things easy for people? And I think that is for me, an important thing that we all have lots of decisions to make. Health isn't always at the center of our thought process. Mm-hmm. And so if we can make decision making in health easier, we're going to make people healthier. And that's sort of the premise. So technology supporting that, but then obviously there's data and how we feed that data back to a doctor. You're seeing a doctor maybe twice a year, but the doctor doesn't know what's happening in between. So part of our philosophy is how do we send that information back to a doctor and say, your patient has, you prescribed this medication, you did all these tests, but your patient has only actually collected it once or twice, so the doctor knows what's happening in those instances. So I think a lot of opportunity to improve how we deliver healthcare, and particularly in the chronic medication side of things.
Craig, let's talk a little bit about the role of behavioral economics in developing solutions. What should our viewers or listeners be aware of?
So let me maybe take a quick step back and give just what behavioral economics is, and it's probably just a fancy term for how we make decisions. And really the work done by, people have actually won Nobel Prizes. Daniel Kahneman passed away recently. And the work that he and others did is understanding that we don't behave rationally, and this isn't again about how much knowledge we have. I know that I should go running in the morning. I should eat these foods. I should take my medicine. There are a lot of things I should do. It doesn't mean I do them. And the thing is, we don't always make the best decisions that are in our long-term interest. And so there are a whole lot of these biases or that or ways our brains are wired that makes poorer decisions. And so we talk about fast and slow. So if you drove into the studio this morning, probably didn't take much thought process. When you started driving, you had to think about it quite significantly. I'm changing gears. The traffic light is red or green or whatever. At your age now, it's almost second nature. So the whole thing of behavioral economics is understanding. So one of the principles, and this is obviously a lot of work before I was the co-founder of Evia. I worked at Discovery heading up Vitality Wellness for about 16, 17 years. And this is really my passion around how we apply behavioral economics and getting people to do things that they should be doing. So one of the concepts is loss aversion. So if we're going to lose something, we work much harder to hold on to that. So, giving people a free Apple Watch, and listeners may be aware of the Vitality program, we saw about an 80% increase in people exercising because people didn't want to pay Vitality back for something that they had been given. And, it had an amazing impact on people exercising, even just people not wanting to not get a smoothie or coffee at the end of the week. So those are all behavioral economic theories. The other concept, which I think is very important in chronic disease, is the one of hyperbolic discounting. And these are fancy terms where we don't think of what things are going to be like in 10 years' time. What is the impact today? So I would go to gym because I'm getting 100 points and I can get my smoothie, not because it's going to prevent a heart attack or cancer or these other things in 10, 15 years' time. And so really what we've done within Evia is use a whole range of behavioral economic principles and apply that, so we've developed the technology, which we believe is the first in the world actually, to print onto people's packs, the pouches that they get the medicine in, and apply these sort of nudges to get people to remind them to do things and really combining. So when I talk about simple technology, we've almost gone back to the physical and the digital, because we do a lot of stuff in the digital world, but medicine is still a physical thing, and we've got to open the pack of medicine. And we've really used the box as a way to educate people, but apply, rewards, apply these sort of behavioral economic principles to get people to take their medicine. And so even just a message of, by not taking this is your risk. Or use a concept such as social norms. And we would have dealt with a lot of that during COVID, getting people to have vaccines, knowing that, I'm an outlier. I don't want to be the only one who hasn't taken my medicines. I want to be part of the group, So that's really, I think, a laser focus that we have around bringing behavioral economics and technology into solving what is a really important healthcare issue, people taking their medication.
How is technology, and you touched on it to a large degree, but overall, how is technology helping with this?
So I have, and I'm not a technology expert at all. I guess, like all of us, live in this world and work in an amazing company like Discovery and similar to Evia. So firstly, the technology is, we've got the technology that does the pull packaging, which is the business that actually Amazon bought in the US. So it's exactly that technology that millions of scripts are being put out every day, giving people sort of, this is when you take the medicine, what the medicine is. So just at a simple level, having your medicine packed like that is one element of technology. That it also creates greater efficiency, because obviously we've got pharmacists overseeing every single script that goes out, but the pharmacist is able to play a slightly different role, because they're not picking medicine and putting it into little packages. The technology is doing that. They're able to then spend more time engaging with the patient and helping the patient understand their condition, understand their medication. And that's where I just think, technology is not necessarily going to do away with roles, but focus on where we need to be assisting people. And similarly, there's some people, like yourself, that takes the medicine, from what you're saying, needs less help. But we've developed also using WhatsApp. So again, almost everyone uses WhatsApp. We're using that platform, but then asking people things around how they feel about their medicine. Is the medicine actually working? Because one of the reasons people stop taking medicine is they don't understand their condition, but it's not working for them, or they're getting significant side effects. So we're able to use the data and technology to pick that up early, so we can say, okay, let's give this patient a call because they're going to be struggling, whereas these patients are fine. And so that level of personalization, technology is enabling that. And as we all know, I don't think there's any conversation that can't involve AI these days.
Sure.
And so that also then helps optimize how we communicate, who we communicate with, being able to predict who's likely to take their medicine, who's less likely to take their medicine. And it doesn't take away from the role of the healthcare professional. I just believe it actually optimizes where they focus. And that's where I love how technology is an enabler, and creates these solutions, but allows us to do things that, that human interaction, that maybe I'm a bit old school, but I think is critical in talking to patients and understanding their issues, and almost like a triage, essentially. So that's sort of the balance between understanding human behavior and using technology to solve some of those issues.
Absolutely incredible once again. If you are listening, give us the thumbs up. Craig, a huge thank you for your time. I know you're in a different part of the world. It seems like you're right in this very room with us. So thanks for spending some of your time with us. Just opening up our minds to to processes that need to be in place, and more importantly, how one should always stick to them and follow them. And again, we can even wrap up by saying and having the conversation around people that think after donkey's years of being on chronic medication that they're okay for them to self-diagnose them coming off that medication, going, I'm fine, Craig, I feel great, I feel on top of the world, I don't need my medication anymore, I'm gonna stop, without seeking medical advice, only to find themselves in a month or two later in a lot worse situation than they've ever been. So please consult your physician. Go and make sure that at any given stage you're aligned with what's needed and that you're taking it on time. Craig, thanks for your time today.
Thanks very much. And maybe just sort of, there's a reason that doctors have studied a long time, and our pharmacists have studied a long time, and it's really around your care and taking the right dose at the right time. And that's, keeps you out of hospital, keeps us living longer and healthier. And that's really the vision that we have in Evia, and obviously Cipla really having a big impact in the world around that side as well. So thanks very much for your time.
Thanks, Craig. And catch your weekly dose of Health Matters, brought to you by Cipla. Remember to like and subscribe to our YouTube channel. And of course, you can watch some of those popular episodes of Health Matters SA. Look for us, Health Matters SA on YouTube. Check them out, and we'll be back next week with another episode.